I am so excited, Renee. We have a special series going on.
We do. We're week number one of the deep dive on behavioral health barriers to change. And I'm excited about this because I bet anybody listening is thinking money. It's not.
It's
Or
not
they're
money.
thinking workforce. It's not. Or is it politics? It's not. So we're going to talk today about what it really is because there are really big barriers to change, and people probably don't even think about them, and they're in your control. Which the part is people really don't understand because they think everything's out of our control. We can't fix anything. Not true. So we're going to talk about that. That's a pretty exciting conversation. But before we get there, what is happening on the farm here at the end of January? What's going on?
Oh, so January and February is conference season for all
Ooh.
farmers. This is when every vendor and every partner you have has big conferences
Oh,
and meals. You go to the Soy Association all day and hear about the
uh,
markets. You go to your precision planting dealer and have an all day thing about what new things are coming out and what
ooh.
technology you should invest in. All of the trade shows happen, the winter ones this time of year, because row crop farmers, you got nothing to do in January and February. So I sign up for as many free meals as I can get, Renee. So I pretty much have lunches, breakfasts, suppers, 5 or 6 a month here in these months where I
Wow.
just sign up. And if you're a farmer, you get everything for free because you have to listen to all you should
But you
buy
might get a new
this.
hat.
Oh, I'll get hats, I'll get sweatshirts, I'll get all the merch.
Nice.
I'm hoping for another Yeti cup. It's, you
Ooh.
hold out for the good stuff. I want a Yeti cooler one time. So,
Nice.
that's kind of how it works on the farm this time of the year. So,
Oh man, I'm sorry to miss out on all that fun or something. So, today we're going to dive into some barriers. And like I said, some of the things that we've already talked about, and you can go back to some previous podcasts, the one at the end of 2025, the beginning of 2026. We talked about some of the themes we saw as we traveled the 15 states across the country this last year. But we were talking about three big ones that we ran into as far as like actual challenges with the system. And those were things like funding, inconsistent mobile crisis is kind of like the policy piece of that's a hot mess along everywhere, and then workforce. But that's not really what we're going to talk about today because there's a lot of other things that can actually create barriers that are, you're going to love this, our own fault. Mm,
mhm.
and we can fix it. And so the good part is you have control in this space. The bad part is you might have to look in the mirror and go, ooh, I have done that and caused some trouble. So let's talk about the first one. The first one is like legislation policy, kind of in that space. I don't know if everybody's aware, but legislators are actually the number one cost driver for lots of things, like
Yeah.
corrections populations,
Yeah.
like behavioral health, like medical, like, I mean, because they make these decisions outside of understanding the big picture a lot of times. And then it's a cost driver because they demand pick a service. And it could be, brain injury coverage, it could be autism coverage, it could be whatever. And it drives costs up. Now, and maybe that's a good thing because maybe things should have been covered that weren't. I'm not arguing the good or the bad, but they are a cost driver. So just make sure everybody knows that legislators are actually most of the problem with their own budget. So I was one. I can call people out. We are that problem. So, in that space, though, in behavioral health, what are you seeing, Jason, as part of the problem with this legislation policy thing that you're
Well,
seeing?
well, I mean, let's just remember. I mean, we've done this work in North Dakota. We've been deep into policy in Nebraska. We know policy here in Iowa, and in across those three, and we know a lot broader than that. But just knowing, like the skeletons in the closet across those three states, we know that policy that's added to old policy, that's added to other old and outdated policy, just makes it so complicated and makes it not work because no one ever goes back and actually fixes the core root problem. And so it's just a band-aid on top of a band-aid on top of a band-aid. And then you end up with a disaster that no one understands and no one's willing to go back and figure out and really get to the bottom of it and fix it right. And sometimes it shouldn't even be a law. It should have been a rule, and now everyone's hands are tied because they can't fix it. And so now we've got another 4 years of people trying to figure it out, and we're stuck with something that doesn't work for anybody.
Yeah. I think about it if you're a visual person, I think about it like a house that you've built and you've tried to build on additions. and
Yeah.
you couldn't really like rebuild the house or refix the frame, so you add on, so you end up with extra hallways, you end up with extra bump outs, like a little bit of extra space here, a little bit of extra space there, but it's not really enough space or enough change to really work the way you needed it to, but you just kind of pieced and parted it together. Happens in church buildings a lot, where they end up with like all these hallway systems because they added on, added on, added on, and there's another hallway to the next addition and the next addition and the next addition, which is great, except for the hallways are all wasted space. And in policy, it happens like that too. And so it can also work like that in data systems. The
Just
corrections data system right now, I'm
yeah.
telling you, was one of these hallway situations.
And one of the things we advocate for is get your issue to an interim committee or get something set so then
Mhm.
people will focus on it.
Right.
What happens sometimes, and I
Sometimes.
just went to one earlier this month, was an interim committee that met one time a week before the report was due for 90 minutes. Guess
Boy,
what? They don't understand the issue. They
no,
they understood the issue worse at the end of the interim committee
mm,
meeting, and now there's gonna probably not be a solid solution for this
no,
session.
no. No. And I tell Jason about this all the time. I'm stuck with writing policy at the Board of Parole for things that I should have no business writing policy for.
Yeah.
It could be tech, it could be, I mean, lots of things. And I'm a therapist by trade, right? So if I'm writing mental health policy, I should be a person at your table for writing mental health policy. I understand policy. I know the history of this said policy that we're talking about today. Did they ask me to come? No. But would I be able to help them in that policy? Yep, because I can tell you how we got there, why we got there, what was wrong with it then, what's wrong with it now, what changes are even possible so that you can make a better solution. I could do that for you because I know that policy. But I get stuck doing other people's policy that I should never be responsible for. So you think about that in the legislature, there's very rarely a champion. This ties into the second
Yep.
thing we're going to talk about, a champion, but a person that's the head of that committee that actually knows behavioral health. So the gentleman in charge of that committee, that's not even his
Nope.
specialty or forte. So it's going to be even harder to understand a complicated system like behavioral health or corrections or whatever when you don't have any knowledge of that in your own life or workspace. And if you don't surround yourself with people who do have expertise in that, you're going to get some really bad opinions on how to fix it. And so then it just tacks on your band-aid idea, add another solution, and it drives up costs, it drives up things. So back to the lack of a champion, what do you see in that? And like you can tie it back to that particular one, but you've seen it. You had a champion in
We
Nebraska though on your work over there, and you can tell the difference with what that happened.
we did. We had a champion, but even when you have a champion, they can get bogged down in the
Right.
bureaucracy and the systems, right? And so, the first thing is find a champion, find a group that's going to support that champion to see something through. But, more times than not, we see, we've seen other initiatives where, we just recently went through a systems change here. And I went from regions to districts, and there were some meetings being held by the former leadership of the region. And when they left, they stopped the meetings because no one would step up and just send an email out saying we should all meet, right? This is a collaborative of providers. And so oftentimes we see people just saying not it and sitting
Yeah.
on the sidelines and not taking any initiative when it's going to help them, their organizations, their systems much more if they just stepped up and said, hey, we still need to work together. We still need to partner somehow. And so, a real champion of an issue is going to kind of put themselves out there and say, hey, let's come up with a solution and let's carry it forward. And it takes a little bit of time and effort. It may take a little extra time and effort, but it's always worth it. But we're in a time where we see a vacuum, a lack of champions coming forward. And I've seen that all across the country as we've been out and about.
And when we just got, I mean, on a refreshing note, we have from one part of the state, somebody just reach out to us to have us
Yeah,
come and help re-energize their
yeah,
people. And she's the champion of that
yeah,
group and
yeah.
trying to say, hey, come up here. It's kind of getting lax. We're getting
Mhm.
lackadaisical. We're not really focused on anything. It's kind of status quo. We'd love you to come up and kind of cheer everybody on, get them pointed in
Mhm.
the right direction, talk about the good things that are happening out there, give them some ideas and see if we can get a champion to kind of take on an action
Yeah,
step or two. And I'm excited about that, but we don't get those requests very often. And so,
no,
to your point about that group that was always meeting, a lot of times, if at some point, if you don't continue the future focus, you end up with just griping, complaining, and
yep,
negativity. In the report you did for our state, you were like, some of these were not useful to continue.
right.
And so, there's sometimes those ongoing just get togethers to complain are definitely not useful, which is why I'm not a big champion of support groups of certain types of disorders. Because
Mhm.
sometimes they just turn into this complaint about our
Yep.
disorder, and all we're doing is making
Yep.
ourselves feel worse and competing with who's the worst in the group. And I just can't, sorry for the soapbox, but those drive me crazy. So that's not what we're trying to do here. So the same is true in policy. You want people to not be isolated, yeah, but you also don't want them to just be in a group where they're not talking about futuristic ideas and hope and change. If they're only complaining about what's wrong, it ends up being just it's a drain on their energy and effort, and there's not a champion at that point. It's just everybody's getting together to pull each other down, and
Right.
that's not good. So it's like there's a fine line there between that, but we're talking about champions. The next one is really surprising to me because you see this all the time everywhere, but a lack of collaboration. So when you think about lack of collaboration, this barrier is 100% our own fault. 100%. So talk to us about what that looks like when some of the work you've done.
Well, I mean, this is my soapbox. I mean, we love to be on the ground, and we go to rural areas, and we're on the ground. We're meeting with providers, we're meeting with hospitals, and I can't even count anymore. And I wish I'm still surprised, Renee, and I shouldn't be surprised anymore because after what 5 years of traveling them all across the country and sitting down across the table with folks, I should know by now not to assume that people in the same community are collaborating and working toward the common good of the people that they serve. And I know that seems cynical, but I can't tell you how many times I've sat at a beautiful new CCBHC that they tell me they're operating to fidelity, that they're doing all these things to manage their patients, they've got data to show it. And I walk across the street to the hospital and say, "You're so lucky to have that CCBHC in the community." And they tell me that's not true. They haven't done anything. We have people dumped in the ED every day. Law enforcement won't talk to them anymore. And I'm like, how can this be? How can I get two completely different stories on the same day, 500 yards from each other? But it happens over and over again, Renee.
Yep. So then the new project I was talking to you about that where you can go to part of our state that wants to kind of re-energize that
Uh-huh.
collaboration going on. I was mentioning to Brent about like the key providers that are in that area
Yeah.
because you guys had just been up there, right?
Yeah.
And then I mentioned a group, a particular institution, and he's like, "Nope, those real people aren't there." And I was like, "What?" He goes,
Yeah. No.
"Well, the name of the group is there, but the people that actually should be there are not there.
Yeah.
So they're not really collaborating because that institution sends like lower level
Yeah.
whoever, and we've been to those a bunch of times, where they send like the whoever. You remember the one we used to do with Russell up there that like I won't name a name of that institution either, but they'd send a
Right.
person that you used to work with, and you'd be like,
Right.
their job has nothing to do with any of this.
Right.
Why is that the person they've sent?
Right.
They clearly had like an open hour on their
Right.
calendar, so therefore they're shoved in this meeting when it's
Right.
supposed to be CEOs and people making
Yep.
decisions, right? So it's like you might have some collaboration with the wrong people at the wrong places, wrong,
Right.
and you're pretending like you're collaborating, but you're sending the third shift dude who just happens to be open
Yep.
when it really needs to be a decision maker that can make
Yep.
change. And so it's like we see this everywhere. So the three that we just covered, these are the three barriers, and we're going to talk more about this with data in just a second. With the three barriers we don't always talk about, but are 100% our own fault: legislation and policy, when people don't know what they're doing that are writing it, lack of a champion to make the change, and then lack of collaboration. So, fun fact, we've dived into some data about change initiatives. So, Jason, tell us how much changes, how much works.
Well, I mean, we know industry wide, 70% of change initiatives fail. And if we look at, whether we can talk about lots of things, right? Like you think about IT implementations, electronic medical record implementations, a high rate of those actually fail, right?
Yeah.
Because it's big change, it's systemic, system-wide change. And we're not good at it because change is hard and change takes a long time.
Yep.
And it means you have to cascade messages through your entire organization. That's why you just can't send the third shift person and say, "Hey, we're collaborating." It's because usually you have to look at what you're doing internally and make changes to really be a partner to others. And that's where most organizations fall short.
Yep. And the most interesting thing about the data is it's often due to people problems.
Yeah,
People problems. So the
people.
three we had above with the policy, the champions, and collaboration are definitely people problems. But let's dive into some of the other people problems that are mentioned when you look at data related to some of this. The people and culture, as an example, people we talk about, they just have fear. They fear, loss of relevance. Have you ever met that person who Because you can't oh man, I just don't even so many thoughts popping in my head, but they don't want to lose their job, so heaven forbid they cross train somebody else because they have to be so important.
It,
And then when they retire or they got hit by a bus, we're screwed because, well, they were so important, they walked away with all the institutional knowledge.
I
Hot mess.
I don't think it's people. I think it's personality.
Maybe.
I can't tell you how oftentimes we've gone somewhere and they're like, "Well, we can't do that because so and so won't do it that way." I'm
Oh,
like,
heaven's sakes.
I mean, let's work on so and so. But literally, it's been because that person was in charge. There's actually a name when I think of a certain state and a certain part of a state. There's one name that everyone will say it's because of so and so. And so finally, I'm like, I want to meet this person because she has
Right?
more power than anyone else across a
Right.
12 county area. And she does have a lot of power and it can be used for good, but we've got to
Right.
harness that, right? And so we've got to deal with the personalities and culture that's in front
Yeah.
of us.
Well, and on the flip side, we've had some change in turnover and just different people retiring, different things at where I work. And I have immediately said to a couple people on a couple of things that have been stuck, I'm like, we need to double check and see if now they can move because so and so
Yeah,
is no longer here.
right.
Because there's some time, and I can't prove it, but and it may not be true, and there may be other reasons why things can't change. But there's a couple of key initiatives that always sort of pounded up against a wall that I think can be unstuck now that so and so's
Yep,
gone. But you'd have to like go look at that because sometimes again we joke about this, but it's not funny. People leave and it was stuck all that time because of Sue, and Sue's been gone for 5 years. Well, you could have changed it as soon as she walked out the door, but you
right,
didn't because you're still afraid of Sue who's
right.
gone. And so you have to then actually go, okay, these are things that didn't really move. Can they move now that so and so's moved on? And so, we get stuck in our own stuff because we don't go back and touch it again because it's always been that way, even though the whoever made it that way is long gone by now or moved on to their own other projects. And so that happens. Another one that's in this list that's interesting in our state because we do it all the time is change fatigue. And
Yeah.
this is the state's fault and can be legislators' fault, policymakers' fault. Just change, change, change. That can be so overwhelming in a system that relies on stability. I know you've seen that not just in our state.
Yeah, and I think systems are spread too thin. And
Yeah,
so I think when it becomes so overwhelming that people just shut down, right? And
yeah,
the same thing happens within systems that you have providers and levels of care within the system that just can't operate anymore because so much has changed they can't keep up. They can't keep up with billing. They can't keep up with the policy changes that have to happen within their own organizations, and that just leads to this. It's kind of like being in a hamster wheel, right? You're just running and running and running, and you have no idea what's happening in the outside world because you're just trying to process all the changes that have been handed down to you. And I,
yeah,
I don't think our legislators and people at HHS or DHSs really understand that there's only so much the provider community and your partners can handle when it comes to change and transitions. And when we're in a
yeah.
place of such rapid change, all the way from federal to state to even local, it really overwhelms the system, and that impacts people directly.
Well, in my office is a good example. I have an office of 11. And so when there's more reports, there's more
Yeah,
tech changes, there's more whatever, we have to absorb it and we don't have those skill sets. And so there's not a report writer in the office. So when
yeah,
they make three new reports, because now we're going to be a government accountable or whatever,
yeah,
and you didn't remove any of the ones already on the plate, right?
yep,
So now we're writing more reports and then they add new training and they add, this required training for technology to be cyber safe or whatever the next one is. You just pile on, pile on, pile on. And we do it to us, do it to teachers, you do it to, where there's just more and more regulations, more and more requirements. And at some point, even if there's one initiative specifically in my office to change, I have all of those external initiatives pushed on too. And so we don't even think about that from a provider perspective. We've changed in the provider world, they've changed like how they've been funded with this whole
yeah,
district change. You've changed like who their contacts are. You've changed like who they work with. They've changed boundary lines. And so the partners they used to have at certain boundaries and regions have all changed. And so it's fundamental pieces that are maybe not a policy shift, but it changes how they do their work. And it's just a lot at one time. And we
yeah.
don't take a responsibility for that. We're just doing the next thing. and they're piling on, and it's a lot. So the next category we're talking about here is leadership and communication. And we've kind of talked about this before above. So I don't know if there's anything more, but that poor communication, not cascading it, not having clear vision. Is there
Well,
anything here that steps out to you for like a leadership thing that you're just like, wow?
yeah, I think we have to recognize that there is a lack of leaders in our small communities. And we see a lot of executives in some of these organizations being the employee that's been there the longest is
Oh
who's
boy.
promoted to the next CEO.
Yeah.
Because if you've got a small board of county supervisors or commissioners, they're like, well, Sue, you've been here for 12 years. You're our most senior therapist. We need somebody to run this place. You know where everything's at. You know the photocopier code. So you're now the executive director. And we've seen that. I mean, I'd like to say that's being a little cynical, but I've seen that. And that person, bless their heart, isn't prepared to lead an organization and make decisions or have the background or the coaching necessary to take over as being executive, whether it be a big organization, a mid-sized organization, or a small organization. It's a skill set you have to learn and develop and really accept. And I think that's been the challenge is leaders are hard to come by. True leaders are hard to come by.
And on the flip side, I won't name any names, but close to me, people I know have been promoted beyond what they wanted or what
Yeah.
they felt comfortable doing. So they quit. Because
Yeah,
and that's when we
absolutely.
lose workforce is because sometimes you put them in the wrong seat on the
Yeah.
bus and they might have been your stellar number one therapist. And as
Yeah.
soon as you've pushed them now into more management of the office, which is not anything they went to school for or anything they wanted to do,
Yep.
they just quit and are like,
Yep.
I'm not doing this job anymore. And then we are always worked up about, well, we don't have enough workforce. Well, part of that's our own darn fault. We just shoved that person that didn't even want the job into a spot and now they're stuck because they really loved being an awesome therapist. We do it to
Mhm.
teachers too. They're really, really good at being an awesome teacher. And then they
Mhm.
get all this extra assignments and then they don't want to be a teacher anymore. It's not that they don't love the teaching. They don't love all the other crap that came with it.
Right.
And if you let them teach, they'd still be there. And then we act like, well, I don't understand why we don't have any more teachers. Well,
Yeah.
because you didn't let them teach. I mean, and it's the same with therapists. It's the same with providers. It's like they loved being with the kids. They loved being with helping people. And then you added, cost reporting on top of it, which they didn't go to school for, don't love, and they're
Yep.
done. And so it's like a two-sided coin there, right? You promote the wrong people, and those that stay that are the wrong person is detrimental to your agency.
Yep.
But the ones that went and they're smart enough to quit, also detrimental to your agency, and now you're down an employee. So it's like there's two sides to that that we really should be thinking much more clearly about and find leadership or train leadership. Leadership isn't innate, it's not born. You can learn it. So you need a leadership training component in your programming to help raise up leaders. You don't just let them figure it out. You teach them how to lead.
And the other part of that is communication. I don't
Yeah.
know when we lost the art of communication, but I can't tell you how many times I've been to organizations and I'm like, how do you communicate that to your employees? And they tell me, oh, I don't think we do. Or just basic things that aren't cascaded through the organization. I'll tell you, I often talk about it. I'm on the board of Kiwanis again. So I go back to service clubs and community organizations because that's where you throw a bunch of people in a room as board members to try to do good and manage dollars. So there's always great things that happen in that microcosm of the world. And we were at a board meeting the other day and we were talking about how do we bring new members in and how do we share with them what we do. And they're like, well, maybe we should talk about it more. And so I asked some questions, like, because that's what I do, right? I'm like, well, how could we share that? Do we have any data? And everyone looks around. Well, no, we do all this good work every year and we give money away. And so I'm like, well, no, like, how many hours do we volunteer? And I look at the secretary, he goes, oh, yeah, I have to put together a report for Kiwanis International every month of how many service hours we do, how many people conducted service, how many projects we worked on. And everyone in the room went, I didn't know we had that. Wouldn't that be great if we shared that every month? And we put it up on the screen and every month we could see that we've done this much, that we gave back this many hours to our local community, that we gave this impact of dollars to community grants. And it was so simple, Renee, that here we have all this data but we're not celebrating it and sharing it with everyone. And that happens at every nonprofit I go to. It happens. Sometimes it happens at hospitals. Sometimes it happens at CCBHCs, mental health clinics, substance use providers, residential treatment providers, you name it. We're not sharing the good work that's being done. We get stuck in that day to day, and we've got to do better communicating.
Yeah. And, and heaven forbid you tie that to actual goals.
Right.
Because if you had, I mean, we just did a goal setting right at the beginning of the
Yeah.
year. And if
Yeah.
you tied that to goals and now you have that data, and if you were like, we want to make sure that we hit this number of service hours a month
Right.
and have this number of new
Yeah.
members a month. I
Yes.
mean, you already have the whole framework there to do it. You just need to put the goal out in front of people.
Right.
So then people be like, well, I know two people that might join. You might be well on your way, but they don't even know back to the vision. We don't
Right.
even know what the vision is or how to measure that vision or to communicate that vision to go there. So it all sort of ties together. But the last part of this is also what you just are mentioning, but follow through and related to
Right.
data collection, not just what you just said, but like even what are we collecting and what are we doing with it? So, maybe poor planning, poor allocation of resources. I talked about on our first podcast in January about how we had to do performance measures for the first time on a new system since realignment in the state. And we weren't even measuring the right stuff in some cases. Then we didn't measure some of it correctly. And so we're like in that whole redoing it. But because they're making us do it now on a timed basis, we can fix that. We write a report and be like, we did not do this correctly. We had to change these. We're totally wrong. This is where we're heading. This is, how we're going to correct it. I had a kind of a corrective action plan, if you will, to
Right.
track better. And it wasn't hard, but it needed to be written down so we knew what we were doing. And so now that I've done the first one, I've already started on next year's with like, they wanted to know like accomplishments. Well, it's a fiscal year situation. So I'm like, okay, I should start writing that now so that next year it's not so
Right.
hard. But now I kind of know the flow to go with it. But, without doing any of that, you're just collecting data. Like to your point, that person's sending it in monthly as a Kiwanian to the national, and you were doing nothing with it. You didn't even know it existed.
And when we say follow through, I think the other part is that means looking at the data, and
Yeah.
if something's not working, cut it. You've got to act. This is really difficult in social services when we're out helping people, but there are absolutely single programs that will tank an organization because they just want to hang on to helping in one area that's no longer funded. And it's a tough decision to make, but we can't keep hiding the problems in our communities if we keep funding things from other areas to try to band-aid it and keep something going that is a legacy program that no longer functions in a way that helps people. And so we have to be able to say no and find other solutions for people who need something specific. But so oftentimes we see organizations who are like, no, we're going to keep delivering that, even though the state won't pay for it anymore. And I'm like, well,
Uh,
what magic tree do you have to continue to do that? Because it hurts everyone around you and it hurts your ability to pay your other employees and to give
well,
them benefits when you continue
yep.
to do that.
Yep. And you and I have to do that. You have to do that on the farm, looking at what
Yep.
you're doing every year, what crops you're planting, how you're planting them, how
Yeah.
you're doing them, what the yields are. You have to decide every year, is that something we should do or not do? We have to do it in our business. We
Yep.
talk about every line of things that put in effort. And we
Hmm.
talked about this on the first podcast of this year about the podcast itself, how it has never been a money maker for us, but what we
Hmm.
we could see the value of what it has done. But if we hadn't seen that value, we wouldn't still be doing this. I mean, I
Right.
can tell you that straight up. You and I put a lot of time, energy, and effort into making a podcast. And if we didn't see value on a return on our investment, we would not. Because
No.
you and I both are like, we're not doing this for legacy. We're doing
Right.
this for a purpose. And if we can't meet
Right.
our purpose, we're not going to. But again, like you just said, a lot of people don't. And so they're doing these extra weird things. And you're like, why? Or there was one, and you were with me in a state where we were at their human services center and people were working at like 40% capacity, maybe.
Yep. Yep.
And they're not making budget because you should have double that to make
Yep.
clients but they were just keeping all the people and they had
Mhm.
this big pretty office that was completely empty and we're just like why what are you doing? And so they're working at 40% capacity. Well, we're not making our budget. Well, no, if your clinician's working at 40% and you
Yeah.
need 80 or above number of percent of
Yeah.
clients for you to make money, That's half. Like, what are you doing? And they, well, it's the way it's always been. Or
Mm.
that when they had the perpetual forever long caseloads where you were caseloaded
Yep.
for life and they had all those fake people on their thing. So their caseload was full because all those people pretty
Yep.
much died, but they didn't take them off the list. What? And so you have to go and say, what? You caseload for life? They don't need services. They're 85 in a
Yep.
nursing home. Why are they on your caseload? Like, what are we
Yep.
doing? And so this happens in state after state after state and system after system. And it's not just government systems, it's nonprofits, it's everywhere. And so this is something for our own lives. This is something that's really important. So now we had a few more extra just stories. We did a lot of stories throughout this, but is there any other story that just sort of top of mind that you're like, this is a barrier, this is a system failure that I thought we should just hit a high note
Well,
before we
I thought we
close?
were going to be more positive, Renee, because
Well,
I mean,
give
I
it a
think
go.
we only get called when there's a system in like it's not working, right? Like we don't get called and people tell us, "Hey, this is working great. Can you come tell us like what we need to look out for?" No, they call us because well, this is not working and we're losing millions of dollars. I mean, we've walked through the new hospitals. I mean, we've seen it over and over again. Even with good planning, we've walked through brand new hospitals that have designed an ED to be safe for mental health patients. And then we're with the person during a walkthrough, like it's almost done, and they're like, "Wait a minute, those light fixtures aren't like aren't the proper ones. What are we going to do about that? Or those aren't the safety fixtures that were supposed to be in this room." And they caught it as we're doing a walkthrough as guests. And then,
Right.
it's like how do this, even with good planning, you have to have
Yeah.
someone who's all over it, who's double checking, triple checking, quadruple checking to make sure things are getting done.
Right. And and to be fair, bringing in that outside perspective, I mean, they saw it when we saw it. As soon as
Hmm.
our faces saw it, they were like, "Oh, those aren't right," and we're like,
Right.
"No, those aren't right." So sometimes you need that extra third person to come in and say that because, if you're in a culture long enough, you may buy what you're all selling. You may just buy
Sure.
into it and be in your own little bubble and buy it. But that's what's so brilliant about a consultant, a third party person coming in, because they may go, did you just say blah, 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 and repeat it back? When I said case management for life, when I named it that,
Hmm.
it was instantaneous. The whole state was like, what? And I'm like, well, you tell me, you said it, not me. I'm just saying this is your process. And they're like, and you could see it like short circuit, like, oh my God, that's terrible. And I'm like, yeah, you'd have a lot more space on your caseload if you got rid of all the people who don't actually use it. And so it's simple, but it took like a outside person to just reflect back. You just said what? And then they go, oh, and they made changes. And so, you can do that all the time.
So I hope we're not going to be a story of failure, Renee, but
Oh,
you know that sometimes we get called into states to create something because it doesn't exist. And we're about to embark on an adventure where we're
adventure.
designing a peer support program for
Ooh,
a state entity, and they're not exactly sure what they want because it doesn't exactly exist. And so we're going to have to work with them to pin that down and then design, develop, and train and recruit people in a really rural area. Like this is going to be a huge challenge. We're going to be doing this for the next 2.5 years. And when we think about well-meaning people putting things out, like this is a huge state initiative and it's challenging because there's lots of pitfalls. And so, I think when we think about these failures happen all the time. But how is it that we're going to respond to them? And how do we make better decisions moving forward? Because some of these things started out pretty sketchy to start with.
yeah.
The original design and methodology, and then the way, the project we're working on, it was RFP'd once. They didn't give it to anyone. They held it for another year, which puts it even 2 years behind when it should have gone out.
Mm,
And now they're like, we need you to do this thing, but everything changed in the meantime. But it's
right.
still the same expectations.
Mm.
And so sometimes it's really hard to navigate all of that.
Yeah, and failure is never failure if it's you're moving forward and you find a better opportunity or things that you need. We talked about this in the goal setting at the beginning of January. Sometimes the goal still is the goal, but the strategy's wrong. And so what you're thinking, what you're running into this is they think they want this peer recovery, blah, blah, blah. You may get into it and go, that's not actually what you need. You
Right.
actually need this other thing. And hopefully you can manage expectations enough to get them to really help answer the problem that they're trying to solve for. It may not look like they think it should look, because right now they kind of have an idea, but they could be wrong. So the fact that they're a little squishy on the idea might not be the worst for you, because
I hope
what they
so.
thought they wanted might not actually work.
But I think the key is sometimes you need someone to come in and help you to turn that failure into a success. And I
That's
think
right.
that's oftentimes where we find ourselves is how do we take this failure and find the path forward to make it work better than it worked before.
That's
And
right.
oftentimes systems have to fail before they heal themselves,
Yeah.
because that's just the way things are created these days. Whether it's policy, laws, rulemaking, a lot of times things fail and that's okay. And part of what, we like to talk about is failure is part of the process, but how are we
Mhm.
going to come back from that and make it better? And so I'm excited for some of these things. That's why I love talking about failure, Renee, because
Well, failure shows you're trying. If you haven't failed, you
absolutely.
haven't risked anything far enough outside your comfort zone to actually make a difference. And so I'd rather fail on things and know that I'm trying than to do nothing. But that's my personality. That's how I'm built. So I push for those kind of things. And it actually ties into our recovering politician self-care policy of the week in a weird sort of way. But I'm tweaking my routines. So I exercise on a regular basis, but I pretty much have to put the exercise clothes right where I fall over them to not miss them, so that I know to put them on and to get it done. And then put like my reading stuff by the bedside table so that I know before bed I want to read. I mean, I have to like make it so super simple for myself that I'm like, oh yeah, I want to read tonight, even though I read every night. Oh yeah, I want to put on my exercise clothes this morning. I do it every day. But it's like I have to make it simple, simple, because I have failed so many times. And for me, if it's cold in the house and I have to walk a long distance to find the exercise clothes and I didn't lay them out, and I have to find them. I don't know. I get distracted. And then I go make hot tea and I sit down, I start scrolling. I didn't exercise and I'm off, all because I just didn't make it from point A to B. So I'm trying to like shorten those parts where it's like, this is a failure point. How do
Mhm.
I do it different? And that's what this whole process is about. Everything we talked about today. It's not bad that you failed if you've learned from it and fixed it. Like that hospital was beautiful, gorgeous. They noticed those problems. They did not go live with the fixtures that would hurt people. They did not. But it took people walking through and go, hey, those are not right. That's not what we ordered for this. The hospital's beautiful. We hear it's working well. We haven't been back. We should go back and see
Yeah.
it. But there's things like that that we come back later and hear, hey, that actually turned out. And so, it is an opportunity. Failure is an opportunity to grow and to learn and to change. And that's where my self-care policy is. If there's something that's not working in your routine, maybe just make it simpler. Just make it so the system is automatic. You just can't fail. And so, Jason, did you have any thoughts about that before we go?
No, I think it's applicable for a lot of things that we do. Is how do you how do you create how do you create systems that play to your strengths, right?
Yeah.
If it's in front of you, then you're more likely to do it. And so we can't put things off. We can't look away. If it's in front of us and we trip over it, then we're going to deal with it. I love
Yep.
it.
I do too. So today we talked about the barriers in behavioral health, not the ones you're always thinking about, but some of the ones that are 100% in our control that we can change. Talking about like how to be better leaders, how to communicate better, how to actually collaborate and make change that actually can last. Next week, we're going to dive into what's kind of care collaboration and more into that collaboration side. We talked on it a bit today, but we're going to dive into deeper dive next time. So please join us for that. But before we go, don't forget to follow us on LinkedIn, Facebook, or YouTube. And if you leave us a positive review, we send you a prize. Thanks, everybody.